Well, for weeks now, we've been telling you of the state and federal agencies that are being affected by the sequester, from canceling White House tours to the grounding of air shows and the closing of air traffic control towers. These cuts are all around us. But unless it has impacted you directly, you may not even have noticed. You might, though, the next time you get sick. Hospitals are still bracing for big cuts, particularly those with medical schools and those that do medical research. And Jennifer Lewke joins us now live in our newsroom with more on just how they will be affected. Jen?
Well, good evening, Liz. These sequestration cuts really couldn't have come at a worse time. We've been reporting on the doctor shortage locally for months now. There aren't enough doctors here to take care of the increasing number of newly insured patients or the aging baby boomers. The key is getting more students through medical school and into residency positions, but these cuts will mean fewer residency spots for them, which will only make the shortage worse.
So just tell me what's going on.
A year ago, when I asked Senator Chuck Schumer what the feds could do to help alleviate the doctor shortage, this is what he told me.
If we expand the number of residence slots, it will be then easier for the schools to expand their number of medical school slots.
But local hospitals say the sequestration cuts do exactly the opposite. Training a medical resident costs a hospital about $100,000 a year. The feds normally cover about $40,000 of the bill for some students, but sequester cuts will slash that. Less money means fewer spots, and since residents tend to stay in the area in which they do their residency, the news is not good.
This generation of medical students, which is like this generation entirely, they believe more in lifestyle than money.
Meaning it's already hard enough to keep them here, and with a record number of physicians retiring, the shortage is likely to only get worse.
If 2 people working 60 hours a week retire, it's going to take 3 people working 40 hours a week to take their place.
One of the main reasons young doctors are choosing not to set up shop or join a local practice, Medicare reimbursement rates here are lower than in other parts of the state because the cost of living is factored in.
The problem is that the reimbursement for the same procedure is less in the Capital District compared to even as close as Kingston or Pittsfield.
And those payments under sequestration will also be cut by another 2%.
So it's essentially a perfect storm of issues that is becoming quite taxing for people who run healthcare institutions around here. And really, it's a nationwide problem that seems to be inflamed by these sequestration cuts at the moment. Liz?
So you take the residency out of this. Is it going to affect us in any other way, this sequestration?
Well, Liz, the National Institutes of Health will lose about $1.5 billion in the first year of these cuts, and that agency funds medical research at hospitals across the country. It's still unclear which programs they will and will not fund with a lower budget, but interruptions in research, even here locally, even just for a few weeks, can set progress back months or even years.
I would say so. All right, Jen, thanks very much. I know you'll stay on this for us.